Hello, Pharma aspirants. Welcome to Pharma Syndrome YouTube channel. I hope you already subscribed to our channel. If not, subscribe to our channel and share our channel to your friends for daily updates and notifications and important knowledge also. Okay. So anyway, today our session is on the diuretics, the classification of the diuretics. I hope you already know what is diuretic. Diuretics are the agents or substances or the drugs. They increase the elimination of excess fluids from the body in the form of urine. And especially when these diuretics can be useful, these diuretics are generally useful in case of hypertension condition, in the case of edematous type of condition. Why? Because in the hypertension as well as in the type of edematous condition, there is a excess fluids in the body. There is excess fluid concentration increase in the body. So to eliminate that excess fluids from the body, diuretics are useful. Diuretics are useful. And especially regarding the classification, you can easily remember by using the tricks. And here the trick is, for the classification of diuretics is C plot. C plot. C means first is carbonic anhydrase inhibitor. So carbonic anhydrase is the enzyme responsible for the increased body fluids in the body, especially due to action of carbonic anhydrase enzyme. There is a reabsorption of sodium into the blood again. If sodium is enter into the blood, there is a along with sodium, water also enter. Again, that sodium and water reabsorption may lead to increased body fluids, may lead to hypertension as well as edematous type of conditions. An example of drugs inhibit the carbonic anhydrase is BAD. And examples like brinzolamide, acetazolamide, dorzolamide. And next, potassium sparing diuretics. So what are these potassium sparing diuretics? So these are the drugs eliminate the sodium and retention of the potassium in the body. So what is the need to retention of potassium? Because there is a already loop diuretics, thiazide diuretics are there. But the drawback of this diuretics is they eliminating the potassium also along with sodium. Elimination of sodium is essential. Why? If sodium is eliminated, water also eliminated. But if excess potassium also eliminated from the body because of diuretics like thiazide-like diuretics and loop diuretics, it leads to hypokalemia, decreased potassium in the body. Decreased potassium in the body may lead to cardiac arrhythmias as well as muscle weakness, muscle problems. And especially the potassium sparing diuretics, two categories are there again. In that first one is aldosterone antagonist. Examples like spironolactone as well as eplerenone. Aldosterone also called as mineralocorticoid. And what is the need of blocking aldosterone? Aldosterone is a mineralocorticoid. It causes retention of sodium and water. If you block the aldosterone function, no retention of sodium and water. And the examples like spironolactone, eplerenone. The spironolactone drawback is it can also block the testosterone or androgen receptor, may causes gynecomastia. But eplerenone is a selective blocker of aldosterone receptors only, and it does not produce any gynecomastia. Next is in this category of potassium sparing diuretic, direct renal sodium channel blocker, examples like amiloride as well as triamterene. So nothing but if it is a renal epithelium on the kidney, there is some sodium channels. If these channels are activated, again sodium enter. If sodium enter, again water also enter into the blood, into the body. If this leads again increased body fluids. So that's why the drugs like amiloride, triamterene block the sodium channels and prevent the influx of sodium and also influx of water and decreases body fluids. Okay. Next, loop diuretics. So regarding the diuretics classification, loop diuretics are highly efficacious diuretics because because of their good pharmacological, nothing but excellent pharmacological action. This loop diuretics also known as high ceiling diuretics. They called as high ceiling diuretics. And regarding thiazide diuretics and loop diuretics, thiazide diuretics are called as calcium sparing diuretics, nothing but calcium storing diuretics. Thiazide diuretics increase the calcium in the blood, in the body. Loop diuretics increase the elimination of calcium. That's why thiazide diuretics are preferred in the patient having osteoporosis, because thiazide diuretics reabsorbing the calcium, and that reabsorbed calcium benefit in the osteoporotic patient. Thiazide diuretics reabsorb the calcium, that's why called as calcium storing diuretics are thiazide diuretics, and calcium eliminating diuretics are loop diuretics. Okay, next osmotic diuretics. Examples of loop diuretics like furosemide, torsemide, bumetanide, ethacrinic acid. And next, osmotic diuretics. The name itself indicating these are the diuretics. By the action of osmosis, they drag excess body fluids into the kidney and eliminate through the urine. And examples like mannitol, which is a sweet substance. It can also used in the pharmaceutical formulation. And isosorbate mononitrate, urea, as well as glycerol. Excess usage of glycerol may leads to the diabetes also. So that is not a very rare condition, but excess use may leads to the diabetes also. Next, thiazide diuretics. So what are these thiazide diuretics? So thiazide diuretics, there are number of examples of there. So these are also a type of diuretics. These are also a type of diuretics, like example chlorothiazide, hydrochlorothiazide, hydrofluothiazide, benthiazide, bendroflumethiazide. Next is thiazide-like diuretics. The mnemonic is C-mix. So here thiazide-like diuretics having the same mechanism of action, that is block the or inhibit the function of sodium potassium transporter at the kidney, sodium potassium transporter at the kidney, and prevent the entry of excess minerals into the body. So inhibitor of sodium potassium transporter. And even loop diuretics also block the sodium potassium 2-chloride transporter. So remember, both thiazide and thiazide-like diuretics blocks sodium potassium transporter. When coming to the loop diuretics block sodium potassium 2-chloride transporter. And examples of this thiazide-like diuretics are chlorthalidone, metolazone, indapamide, xipamide. The thiazide-like diuretics preferred over thiazide diuretics because of long duration of action. So the thiazide-like diuretics preferred in the treatment of hypertension because of long duration of action compared to the thiazide diuretics. Okay, the thiazide-like diuretics are preferred over thiazide because of long duration. And this thiazide and thiazide-like diuretics having same mechanism, that is inhibit sodium potassium transporter, and but they're differing in the chemistry, their structural chemistry. Okay, so this is regarding the classification of diuretics. So by this manner you can easily remember. For more like these videos, follow our channel and subscribe to our channel. Thank you.